or classify them as palliative care. But palliative care isn't just the physical care that we provide, it's more of an approach or more of an attitude. And some of the characteristics of hospice palliative care is that it recognizes dying as a normal process. So, like, it recognizes the decline of your loved one or client. It confirms that the dying person and their family members should be looked after and cared for. So it's more about the family unit. And we do provide that care in a holistic way, keeping in mind our dimensions of health that we mentioned earlier. And we also want to provide preventative techniques or early detection of symptoms so we can provide the highest quality of care possible to our clients when they are in decline. Now, terms that are kind of used with palliative care, such as end of life care, chronic illnesses, holistic care. End of life care is a general term that we use for our loved ones when they're nearing the end of their lives. Holistic care is more the holistic approach, looking after all of our clients or loved ones' needs. Hospice is the building that they would go to. Hospices are very interesting because the care they provide is very focused, very client-centered. Like hospices are usually a building out in the community, like a house. And then inside of that home, you're going to have like a doctor, a nurse, PSWs, and usually there's only 2 or 3 patients or family members at the end of their lives. So it's very concentrated and focused. That's why some people pick hospices over other places nearing the end of their lives for those types of reasons. Okay, so what is this palliative approach that we're kind of talking about? In a physiological way, we're kind of talking about integrating not only our clients or loved ones' diagnosis, but also how we're going to approach or kind of integrate the quality care that we want to give them. We want to kind of start some of these preventative techniques as early as possible. So palliative care is 6 months left to live or less, but sometimes we want to have these preventative treatments start right away. So if I use nursing homes as an example, residents that move into a nursing home, the average lifespan after they move in is 18 months. So if they live there for a year and then they go palliative care for the last 6 months, the philosophy is, why didn't we start that when they first came into the nursing home? Why didn't we start some of these preventative measures or even curative techniques? Like, yes, maybe they have cancer, maybe it's stage 4 cancer. And then is it going to be helpful to do different types of therapy like radiation therapy, chemotherapy? Those types of therapies should be still instituted. So you're kind of using curative techniques to provide the highest quality of life possible. Like, you don't give up on any positive techniques that are working for your client or loved one. You want them to have that highest quality of life while they're still in decline, right? So these types of terms mean different things to different people, but the term palliative care is the one that we use in healthcare and the one that means the client is nearing the end of their life through decline. So